Hello, this is Dr. Sukalyan Purkayastha. I'm a neurointerventionist. I work in the Institute of Neuroscience, Kolkata for last 10 years. And today I'll be talking about a very important and elegant treatment process called vertebroplasty. Many of us have seen in our families or friends, they suffer compression fracture in the spine and they come with a lot of pain in the back, and usually it happens in middle-aged female or in older population where there is lack of calcium in the bones. So with a trivial trauma there can be a fracture in the vertebral bodies and the patient can experience tremendous excruciating pain in the back, and he or she will be prescribed for braces, calcium, painkiller, but usually that do not give much relief. And obviously too much of a painkiller is also detrimental to kidneys and other things. So there is a very elegant technique called vertebroplasty. What we do is we place a small needle through the back of the patient into the fractured vertebral body by fluoroscopic guidance in cath lab. And as you see in the cartoon, there is we are filling the vertebral body with bone cement, and what it does is it immediately strengthens the fractured vertebral body. So the indication is osteoporotic compression fracture. Sometimes in metastatic disease of the spine we do vertebroplasty to stabilize the spine and to reduce the pain. Sometimes a very common tumor of vertebra like hemangioma, we do these procedures quite regularly. How we diagnose it? Definitely by doing a CT scan. As you can see here in my screen, there is a hemangioma affecting the vertebral body. Another example, there is a compression fracture diagnosed with a CT scan. Of course, you can do an MR scan as well, as you see in the slide, and that will show the status of the bone, the ligaments, and the spinal cord. So obviously, MR is a single most important diagnostic technique in the spinal diseases before embarking on any treatment modality. And this is an example of vertebroplasty. You can see a fractured vertebral body. We have placed a needle and filled the vertebral bodies with bone cement. Here is another example how the vertebroplasty treats a bone hemangioma. Now, this is a very short video I have kept for you to understand how we do it. So this is the fluoroscopic image. As you can see, both the AP and lateral images of this fractured vertebral body, and this is done under local anesthesia. We infiltrate the skin, the muscle, and the bone with the local anesthetic and take this needle under fluoroscopic guidance. As you can see here, the needle is being taken and it is placed in the anterior part or in the front part of the vertebral body, and we start injecting the bone cement. Now, what is bone cement? This is also a mixture of liquid and a powder of polymethyl methacrylate. So this is a what we call bone cement. The same cement is being used by the orthopedicians for joint replacement, and the same cement what we infuse. So what it does is when you mix the solid and the liquid, it causes some exothermic reaction. That means it emits heat. So by emitting heat inside that vertebral body, it burns the free nerve endings, and that's how it reduces the pain, and it joins or it glues the fractured bone, and that's how it prevents further fracture of the bone, further reduction of the bone height because it's already osteoporotic vertebra. That means the bone calcium is less, and the patient can be mobilized within 24 hours or even within 48 hours. And most of the patients will experience at least 95% reduction of pain after vertebroplasty. And this is the slide. As you can see that I'm AP and lateral again after how the bone cement has taken the volume of the vertebral body, and it has restored the height of the vertebral body, and it has stabilized the vertebral body. So in conclusion, I would say that vertebroplasty is extremely safe, it's cost effective, and gives adequate strength and pain reduction, And the most importantly, you can avoid brace and painkillers, so which will be your friend if you do not treat those patients treat those vertebrae with vertebroplasty, and if you just depend on painkillers and calcium. So this is an elegant technique for treatment of vertebral fractures, and we should not be wasting time in treating these patients when we encounter this sort of diseases. Thank you very much.